Welcome. We're here to, cut through the noise and get straight to the facts that matter for your health.
Absolutely. And today, we're tackling something really important.
Yeah, we all want to stay healthy, right? Especially as we get older. And it just feels intuitive that more checkups must mean more safety. You go in, get the scan, feel like you've ticked a box.
It's a very common assumption. We're almost trained to think that way.
But what if that's not the whole story? What if there's this hidden truth that, well, most seniors just aren't hearing from their doctors?
Exactly. We're talking about a situation where some routine health checks, especially, say, after age 70, might actually lead to more harm than good. Unnecessary procedures, side effects.
And the numbers are pretty startling when you look into it. Some new studies are showing that, get this, up to 37% of medical tests in older adults lead to treatments they didn't need, or complications, even lifelong side effects.
That's a huge percentage.
It is. And maybe even more shocking, something like 99% of people over 70 have no idea they might be getting over-tested, just completely unaware.
It really suggests our approach to preventative care needs a bit of a rethink as we age. More screening isn't always the better path, particularly later in life.
And honestly, some of this is just astonishing. Like one specific checkup we're going to talk about, it's number one on our list today.
Yep.
Well, it's now potentially linked to causing up to 5% of all cancer cases in the U.S.
Wow. 5%?
Yeah. That puts it in the same ballpark as daily drinking as a cancer cause. You definitely don't see that on the clinic brochure, do you?
No, you certainly don't. That's quite a statistic.
So today we're doing a deep dive. We're looking at the science behind 5 specific tests that really deserve a second look if you're over 70. Our mission is just to unpack what the data really says, to, empower you with knowledge.
Let's get into it.
Okay, starting our list at number 5. It's something that sounds totally harmless, maybe even smart. The bone density scan, the DLEXI scan.
Right. Quick, painless, measures bone strength. Mainly looking for osteoporosis. Seems sensible.
Totally. But here's the twist, especially for people over 70 and particularly women. Well, the DEXA results often show lower density, but that doesn't always mean there's a real danger.
That's key, because some bone loss is, frankly, a completely natural part of aging. It's expected. Kind of like getting wrinkles or finding more gray hairs.
Right. But what happens then, even though it might be normal aging, seniors often get pushed towards medications, things like bisphosphonates.
And this is where it gets really interesting, or maybe concerning is the better word. These drugs, they're not without risk. We're talking serious side effects.
Like what?
Well, things like jaw necrosis, that's where the actual jawbone can start to die,
Right.
and esophageal irritation, severe heartburn. It's not trivial stuff.
Jawbone dying, that sounds terrifying.
It is. And the science backs up this concern about the risk-benefit balance. Studies show that for mild bone loss in people over 70, taking these meds has very little impact on whether they actually break a bone.
So the main benefit isn't really there for many people.
Not significantly. There was a big study, Journal of the American Geriatric Society, followed over 1,200 women over 70. The bisphosphonates, they reduced fracture risk by only 0.3% after 5 years.
0.3%, that's tiny.
It's negligible for most. But those same women, they were much more likely to suffer side effects, digestive problems, that esophageal inflammation we mentioned, even strangely brittle bones in some cases.
Wow, so the drug meant to strengthen bones can make them brittle.
It's a known paradoxical effect in some patients, yes.
Okay, let's make this real. Tell me about Rose.
Right, Rose. She was 76, a retired piano teacher, still active, walking daily, no falls, no pain. Her doctor sent her for a routine DEXA.
Okay.
It showed osteopenia, that's mild bone loss, not even osteoporosis. But the doctor immediately prescribed alendronate, a bisphosphonate.
And what happened?
Within 3 months, she developed terrible reflux, really bad jaw pain. It got so bad she couldn't play the piano anymore.
Yeah.
Which is heartbreaking for her.
Oh, that's awful. So what did you do?
Well, we looked at the whole picture. We took her off the drug. Focused on lifestyle instead.
Like what?
Simple things, really. Making sure her vitamin D level is good, adding some gentle weight-bearing exercises. Resistance bands are great for this, and focusing on calcium-rich foods. Leafy greens, sardines, things like that.
And the result?
A year later, she was back, playing piano recitals, her legs were stronger, balance was better, and importantly, 0 fractures.
That's a fantastic outcome. So the takeaway here is,
For people over 70, especially if you're not falling or breaking bones, lifestyle changes are often the much better, safer route. There's good evidence for it, too.
yeah.
A 2022 study in Osteoporosis International, it showed strength training, balance work, good nutrition, fixing vitamin D deficiency, that combo can cut fracture risk by over 20%.
20% from lifestyle versus 0.3% from the drug. That's a pretty clear comparison.
It really is. Don't let a number on a scan automatically push you into taking a medication you might not need or that could cause other problems.
Okay, moving on to number 4. This one hits close to home for a lot of people. Brain MRIs for memory loss.
Ah, yes. A big one. When seniors start feeling more forgetful, maybe a bit confused, the immediate fear for them and often for their families and doctors is dementia, Alzheimer's.
Understandably. So the doctor orders a brain MRI, a detailed scan. Seems logical.
It seems logical, but the difficult truth is these MRIs, they rarely provide the clear answers people are looking for.
How so?
Well, in most people over 70, the MRI just shows normal age-related changes. A bit of shrinkage, maybe some white matter spots. These are often just the brain's equivalent of gray hair, not necessarily a sign of disease.
But finding those spots, even if they're normal, that must cause anxiety.
Oh, absolutely. And this is what's fascinating and worrying. Once these perfectly normal age-related spots are flagged on a report, it can trigger what some call a cascade of fear.
A cascade of fear.
It leads to more anxiety, more tests, sometimes even invasive procedures like biopsies. Things that might not improve memory at all and could potentially make things worse through stress or complications.
Is there data on this?
There is. A 2021 study, Neurology Today, looked at over 3,000 MRIs in patients aged 70 to 85 with just mild memory complaints.
Okay.
86% of the scans showed some kind of abnormality. But, and this is the crucial part, only 3% were linked to something actually treatable.
So 97% of those people got told something's wrong when it wasn't really a problem.
Essentially, yes. They went through that emotional ringer for findings that were likely just normal aging. And it gets worse. Nearly 12% were then sent for more invasive tests like spinal taps or even exploratory biopsies based on these vague MRI results.
That fear spiral sounds debilitating. I remember you mentioned George.
Yes, George. 74, retired engineer, sharp guy, but worried because he was misplacing keys more, occasionally forgetting a name. Standard stuff, really. His doctor ordered an MRI. It showed some white matter changes, which are common. But George panicked, convinced he had early dementia.
Oh, no.
He stopped driving.
Yeah.
Stopped going to his church group. His anxiety just skyrocketed over the next few months.
So the scan actually made his quality of life worse.
Dramatically worse. But then, when we actually sat down and did a proper standard cognitive test, the paper and pencil kind, his score was well within the normal range for his age.
Really?
Yes. So we explained the MRI findings were likely age-appropriate, nothing to panic about. We helped him focus on lifestyle factors, better sleep, staying hydrated, doing some brain games he enjoyed.
And did it help?
Within 3 months, his memory felt stable again. And crucially, the fear was gone. He got back to his life.
So the lesson here seems to be, unless there are really serious neurological red flags.
Exactly, like seizures, sudden major personality changes, a really rapid decline in function. Unless you see those things, an MRI for just mild forgetfulness is rarely the best first step.
What is that?
A good cognitive screening test. It's simple, usually paper-based, evaluates memory, attention, problem-solving. It's cheap, effective, and it avoids triggering that unnecessary panic and the cascade of follow-up tests.
Okay, number 3 on our list, brace yourself, because this is a really common one. The cardiac stress test.
Ah, the treadmill test.
Where?
Or sometimes they give you medication to speed up your heart if you can't use the treadmill.
Right. Super common for seniors who mention feeling a bit tired, maybe some mild chest tightness, or just, not having the same pep. It's supposed to spot blocked arteries.
Supposed to. But here's the problem, especially after 70, and particularly if you don't have clear classic symptoms of heart disease. This test can often do more harm than good.
More harm? How?
Well, a big part of it is accuracy, or lack thereof. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%.
40%. So almost half the time it says there's a problem when there isn't one.
That's right, a false alarm.
And the really crucial thing is, what happens after that false alarm?
Exactly. That's where the cascade starts again. A positive stress test, even a false positive, often leads directly to more invasive follow-up tests, things like cardiac catheterization and angiogram.
Where they thread a tube up to your heart.
Correct. And that can then lead to procedures like putting in stents or even bypass surgery that maybe weren't needed in the first place.
Is there evidence for that? For unnecessary procedures?
Oh, yes. A major study in JAMA Cardiology back in 2017 looked at this. They found over half of all the stents placed after a stress test referral were in patients who didn't actually have significant symptoms or derive any real benefit from the stent.
Half. So they went through the procedure for nothing.
Essentially, yes.
Yeah.
No improvement in survival, no improvement in quality of life. But what they did get was exposure to risks.
Risks like?
High rates of bleeding complications, potential kidney injury from the contrast dye used in the angiogram, longer hospital stays. It's a classic case of the cure being potentially worse than the non-existent disease in some cases.
Wow. Okay, let's hear about Raymond.
Raymond, right? 75, retired postman, pretty active walker. Mentioned to his doctor he sometimes felt a bit tired walking up steep hills.
Okay, seems mild.
Very mild. But the doctor said, let's do a stress test just to be sure.
The classic line.
Indeed. The stress test results came back. Unclear. Ambiguous. So, next step. Catheterization.
Ran to the invasive test.
Yep. They found a mild narrowing in one artery. Debatable if it was even causing symptoms.
Yeah.
But they put in a stent anyway.
And then?
That night, Raymond had a bad reaction to the contrast dye. Developed acute kidney problems. Spent 6 days in the hospital. Needed weeks of follow-up care.
And did the tiredness on hills go away?
Nope. Never changed. Because it likely wasn't his heart in the first place. He was probably just, a 75-year-old guy who maybe needed to pace himself better or drink more water.
So the actionable insight here is be wary of stress tests unless you have really clear symptoms.
Pretty much. Unless you're having classic cardiac symptoms, chest pain or pressure during activity that goes away with rest, significant shortness of breath on exertion, a really noticeable drop in your energy levels doing normal things, then a stress test might be more risky than helpful.
Are there better, safer options for a first look?
Often, yes. A simple resting EKG can tell you a lot about the heart's rhythm. Or maybe a coronary calcium scan that's a low-radiation CT scan that specifically looks for hardened plaque buildup in the arteries. It's much less likely to trigger that cascade into unnecessary procedures.
All right, coming in at number 2. This one might surprise people too. It's the colonoscopy.
Yeah, the procedure with the camera to look inside your colon. Very common screening tool.
Super common, but maybe not always the best choice after 70 and almost never recommended after 75 without specific symptoms.
That's the current thinking, yes. The risks start to increase quite significantly with age.
And let's talk about those risks, because I think people underestimate them. It's not just the procedure itself, is it?
Not at all. First, there's the prep. Those strong laxatives, they can be really harsh, especially for older adults. Risk of dehydration, dizziness, electrolyte imbalances, even kidney problems.
Right. The prep alone can be tough.
Then there's the sedation needed for the procedure. That carries its own risks for older adults, potentially affecting brain function, confusion, even falls afterwards.
And the procedure itself.
The procedure itself, while generally safe, does have risks that increase with age. Things like bleeding, especially if polyps are removed, perforation, a tear in the colon wall, which is serious. And sometimes cardiovascular events like heart rhythm disturbances during the sedation.
Okay, so the risks are definitely there. What does the data say about the benefit versus risk after 75?
It's quite stark, actually. A big study in JAMA Internal Medicine from 2019 looked at over 1.3 million Medicare patients aged 70 and up.
And
For every 1,000 colonoscopies done in patients over 75, they estimated only about 2 lives were saved from colon cancer.
2 lives per 1,000 procedures. Okay.
But in that same group of 1,000 procedures, over 20 people experienced a serious complication. Hospitalization, significant bleeding, perforation.
Wait, so 2 lives saved versus 20 people harmed. That's a 10-to-1 ratio of harm to benefit.
That's what that study suggested, yes.
Yeah.
A pretty unfavorable ratio. And another point, even when they find polyps in older adults, many are small, very slow growing.
So they might never have caused a problem anyway.
Exactly. They might have died of something else long before that polyp became cancerous. And removing it carries immediate risks. Sometimes leaving it alone is the safer option.
What's your Dana story?
Dana, 73. Ran a small bakery, very active grandmother, no symptoms at all, no bleeding, no change in bowel habits, no family history of colon cancer.
Sounds low risk.
Very low risk. But she got a new primary care doctor, young guy, fresh out of residency, really pushing the screening guidelines. He urged her to get a colonoscopy.
Even though she was 73 and maybe didn't strictly need one?
Right. She felt pressured, so she agreed. They found and removed a small polyp during the procedure. Sent her home.
And then?
That night, she developed severe abdominal pain. Fainted. Ended up in the ER.
Oh my goodness.
Diagnosis.
Oh.
A bowel perforation from the procedure. She needed surgery. spent 9 days in the hospital, lost 10 pounds she couldn't afford to lose. It was a long recovery.
All from a screening test she might not have needed. And I think you mentioned she'd had previous ones.
That's right. Turns out, when they reviewed her records later, she'd already had 2 completely clean colonoscopies in the past decade. There was really no strong medical reason to do another one so soon, especially at her age.
So the bottom line on colonoscopies after 70 or 75.
The official guideline from the U.S. Preventive Services Task Force is generally to stop routine screening at 75 for most people. If you're in exceptionally good health, maybe talk to your doctor, but weigh those risks carefully.
Are there alternatives for screening if you are concerned?
Absolutely. For many people, especially those at average risk, stool-based tests are a great option, like the FIT test.
How does that work?
It's simple. You do it at home, just collect a small stool sample, mail it off. No prep, no sedation, no time off work, no risk of complications from the test itself. And it's very effective at catching most significant cancers or large polyps. It's definitely worth asking about.
And now we've arrived at number 1. The test that might be the most overused, potentially the most harmful, especially for general screening in seniors, the annual full-body CT scan.
Yes. Often marketed in these executive health packages or by private preventive clinics. The pitch is always about catching cancer super early.
Sounds appealing. Who wouldn't want to catch cancer early?
Of course. But here's the shocking reality. These full-body scans, done without any specific symptoms, they expose your entire body to a significant dose of ionizing radiation.
The kind that can damage cells.
Precisely. Enough energy to potentially damage DNA. And for older adults, the risk of these scans finding incidental, harmless things triggering unnecessary follow-ups, biopsies, surgeries, anxiety is incredibly high.
And the kicker?
The kicker is there is zero, absolutely zero scientific evidence that these screening full-body scans done on people without symptoms actually save lives or improve overall health outcomes.
Zero evidence of benefit, but definite risks.
How much radiation are we talking about?
It's staggering, really. A single full-body CT scan can deliver somewhere between 10 to 20 millisieverts of radiation.
Which means
To put that in perspective, that's roughly equivalent to the radiation dose of about 500 standard chest x-rays, all in one go.
500 chest x-rays. Wow. That can't be good long-term.
It's not. And the data is starting to show a really concerning trend. There was a modeling study published just last year, 2023, in JAMA Internal Medicine.
Okay.
It suggested that the massive increase in CT scan use across the U.S. might now be responsible for up to 5% of all cancer diagnoses.
Wait, the scans cause 5% of cancers?
That's what the modeling indicates, yes. That puts CT radiation right up there with factors like daily alcohol consumption as a contributor to overall cancer rates. So the test meant to find cancer might actually be causing it in a significant number of cases.
That is the terrifying possibility, yes. 1 out of every 20 cancers potentially linked to a diagnostic scan. And think about how these scans work.
They find tiny things, right?
Exactly. They're incredibly sensitive. They'll pick up tiny harmless nodules, little calcifications, cysts, things that are just normal wear and tear or benign features of aging. But once a radiologist sees anything, they have to report it.
And that sets off the alarm bells.
Red flag goes up, which triggers more scans, maybe a PET scan, referrals to specialists, biopsies, and a whole lot of panic and anxiety for the patient, all for something that likely would never have caused a problem.
Can you share Marcus's story here?
Yes, Marcus, 80 years old, remarkably fit, still teaching martial arts to other seniors, felt absolutely great, decided to do one of these fancy elite senior checkups at a private clinic.
Included a full-body CT.
You guessed it.
Yeah.
The scan showed a tiny 3-millimeter nodule in his lung. Probably nothing, but it triggered the cascade. Oncology referral, PET scan, then a needle biopsy to be absolutely sure.
And the results of the biopsy.
Benign, completely harmless scarring most likely.
Okay, so good news in the end.
Not quite. The needle biopsy procedure itself caused a complication. It collapsed part of his lung, a pneumothorax.
Oh, no.
He ended up needing hospitalization, a chest tube, took him 2 full months to recover. All that pain, risk, and recovery time for a harmless speck found on a scan he never needed.
That's just awful. So the takeaway on full-body CT screening?
Unequivocal. Experts and major medical organizations like the American College of Radiology are crystal clear. Full-body CT scans should never be used for general screening in people without symptoms, period.
No proven benefit, significant potential for harm.
Exactly, both from the radiation itself and from that cascade of unnecessary follow-up tests and anxiety.
So what's a smarter approach?
Listen to your body. Pay attention to real symptoms. Unexplained weight loss, persistent pain, coughing up blood, a lump you can feel, visible swelling. If you have specific symptoms, then targeted imaging, like a chest CT for a cough or an abdominal ultrasound for belly pain, might be appropriate. But scanning your whole body just in case, it's like searching for treasure with a landmine detector.
You might find something.
But you're far more likely to cause damage along the way.
So there you have it, 5 really common health checkups that, especially once you're past 70, might seem like a good idea, but can actually carry pretty significant risks. Sometimes risks that really outweigh the benefits.
It really drives home that modern medicine, while incredibly powerful, isn't perfect. And sometimes, genuinely, less is more.
It's so easy to get caught in that more is better mindset with health, isn't it? We want to be proactive, do everything we can.
It's a natural instinct. But as we've seen today, being proactive needs to be balanced with being informed about the potential downsides, especially as our bodies change with age.
So, a key takeaway for everyone listening. Maybe the most important question to ask your doctor before any test.
Absolutely. Always ask, okay, if this test finds something, what happens next?
And if the answer is vague, or involves more tests with their own risks.
Or if the potential benefit seems small compared to the risks of the test or the follow-up, then it's perfectly reasonable, even wise, to pause, to say, hold on, let's reconsider if this is really necessary for me right now.
Because true prevention, real health, it often starts somewhere else, doesn't it?
It really does. It starts with the fundamentals. Staying as active as you can, eating well, getting good sleep, managing stress, and yes, choosing your medical tests wisely, not just automatically.
So as we wrap up, maybe a final thought for people to ponder.
I think it's about empowerment. If we connect this all to the bigger picture, how does understanding these potential harms, these cascades of intervention, actually empower you, the listener, to be a better advocate for your own health?
To ask better questions.
To ask better questions, to make more informed decisions as you navigate healthcare, especially as you age. What could you potentially gain in terms of peace of mind, quality of life, avoiding complications by having perhaps fewer but much more targeted and necessary medical interventions?
Something definitely worth thinking about. Keep asking questions. Keep digging deeper.
Keep learning. Your health is worth it.